procedure that is going to help dissolve a fat pad underneath the chin and to tighten the skin in the neck. We'll be using a device called an Exilis, which is a radiofrequency device for the neck tightening, and we will be injecting into the fat pad under the chin a combination of products that are called a Lipodissolve formula, and we do that first prior to the skin tightening, and then we will apply gel onto the neck and we will start the skin tightening procedure shortly thereafter. Okay, so we're gonna have a little pinch. You okay? So this is not a process that goes away with a single treatment. It's usually a series, both with the skin tightening and with the Lipodissolve. So anywhere between 4 and 6 to get the desired response. Okay, so in an Exilis treatment, we apply a lot of gel to the skin. The purpose of the gel is to cool the skin and to allow the handpiece actually to glide. So what exactly are we doing with a radiofrequency treatment? So radiofrequency is a form of energy. Energy creates, in this case, heat, and we're applying heat to the skin in order to allow the collagen to get recoiled tightly, which is something that collagen tends to become uncoiled, kind of like a slinky toy getting all stretched out. And so when we are, when we expose our skin to UV light, that's what happens. Our collagen breaks down and the slinky toy becomes like a long, loose snake instead of a nice, tightly coiled form of fibrils. And so by applying radiofrequency heat, what we're doing is we're creating an opportunity for collagen to repair itself and to become tightly wound. So in the procedure, it's pretty comfortable. As you can see on this, there's a red screen that shows her contact with the skin. So she's got nice contact, and she's basically just drawing kind of like you would color a drawing in public school. So the device has a nice metronome sound to it, and after 30 seconds it stops to allow, the patient to comment whether it's getting too hot or uncomfortable. Generally speaking, most of the time this is a very comfortable treatment, and some people actually fall asleep. Why do we use this particular form of energy? Number one, it's an extremely safe form of energy to tighten skin. There's only really one reason why someone could not have this treatment, and that is if they have a pacemaker. Radiofrequency can interfere with the functioning of a pacemaker, so that's about the only individual who cannot have this treatment done. It does not affect any pigment in the skin, so any person with all skin types can have this treatment done. And there's really no significant downtime to the procedure, so at the end of the treatment, essentially all we're going to see is a slight pinkness to the neck, in this case the neck, and someone can go back to work immediately without having to do anything in terms of aftercare either. Because of the heating of the skin, the only requirement that we ask all our patients is to drink a lot of fluids, because the heating of the tissue does affect hydration, and so we do want we want people to be hydrated. Okay, so when we're doing body treatments, we use this handpiece. This handpiece allows us to do a fat reduction treatment as well as a skin tightening treatment based on the settings that we put on the machine. We always do the fat reduction first. It actually heats the fat deep under the skin, helps to dissolve it and rupture the fat cells, and then we follow that with skin tightening so you get a nice overall result on any body part: flanks, abdomen, inner thighs, outer thighs, back of arms. So the procedure is pretty comfortable for both the provider and the patient. As you can see, there's just some nice pink that's developing on the skin. And that's pretty much the only reaction that we're going to see as a result of the treatment.